Good afternoon, good afternoon, good afternoon. Hello, everyone. Hello, everyone. This is Mark Calhoun. I'm with CareSouth Carolina, and this is the CareSouth Carolina Community Live Podcast. Again, I'm the Director of Social and Community Services, and once again, my partner in crime.
Yes, this is Daniel. I'm the Medication Assisted Treatment and Substance Use Disorder Program Director for CareSouth Carolina. Figured I'd just make that plain so I just wouldn't use just the letters so people actually know what that stands for when I say it. So, yeah, that's what I do here at CareSouth Carolina, and I love it. Yes, I do.
All right.
That's right. That's right.
So as always, we have a very special guest in the building on the line with us today. Um, we reached down, way down in the big metropolitan of Dillon, South Carolina, and we come to present to you today Miss Samantha Willard, nurse practitioner in our Dillon Center. Right.
Hey.
Welcome to the show. We've been wanting to get you on for a while. Welcome to the show.
Thank you.
All right.
Glad to be here.
Oh, thank you. We're happy to have you here.
Yes.
If you could just kind of start off the show out with kind of tell us a little bit about yourself. Give us a little history of Miss Samantha Willard.
Okay. I've been with CareSouth now 4 years. I've been working in Dillon County for 6 years. I came from McLeod, worked there for 2 years as a nurse practitioner at McLeod Pediatrics. I really have enjoyed my time here at CareSouth. I see pediatric patients along with adult patients. I pretty much treat patients of all ages from newborn up to geriatric age. I treat MAT patients as well as, pediatric and geriatric. So, I cover all age spectrum. I enjoy it. It's a challenge, working, switching gears. I'm very grateful for the team that we have here in Dillon. They work very patiently with me. They have my back. They never fuss or complain. I have a wonderful nurse who, is right here working with me, to get the job done. And we try to do it, to the best of our ability. I've also worked in other areas as a nurse. I've done IT. I've taught at 2 of the local colleges, at a technical college, Florence Darlington Tech, pediatrics, and I've also done clinicals at Francis Marion University as well before I became a nurse practitioner. I'm currently enrolled in a doctorate program, working on my DNP. Should be finished with that in a little over a year. So kind of, doing that to help grow my knowledge and help, be a better nurse practitioner for my patients here at CareSouth. And just be a better practitioner for the CareSouth organization. So I think that's about all I can say about myself.
Well, we appreciate that. So this next year, you'll be Dr. Samantha Willard.
Well, I guess. I hope. If I don't give up, I'm trying to hang in there.
You got it. Got it.
You're gonna do fine. So Samantha, you said that you do pediatrics. What are some of the issues in Dillon County that you've seen that's really been that really troubles you about our pediatric population?
Well, what I see, and it kind of ties hand in hand with a lot of my MAT patients. a lot of my MAT patients are parents.
Right.
And a lot of those patients have lost their children due to their drug use.
Mm-hmm.
And some of them are trying really, really hard to do the right thing and get the help by coming to CareSouth to get into our MAT program and, you know, get themselves clean and on the right track, doing the counseling, getting through the Suboxone program, and showing that, hey, I'm staying clean, I'm doing my counseling, I'm, doing a 180 and doing the things that I need to do to get my children back. Because as a result of, the choices they've made from their drug use, and some of it has not been, I just woke up one day and decided to use drugs. Some of it has truly been, I had an injury. I could have been in a car accident, or, I broke an arm and I had to have surgery, and I was prescribed this medication by a physician, and I got cut off and I got addicted to it. And as a result, I, lost my children. So now I'm trying to get back on the right track and get my children back. And my kids are in foster care. So as a result of them losing their children, now their children are, in a strange place with strange people, and their children are suffering just as well as the parents are suffering.
Right.
So I see that. And I also see kids who, on the other hand, who are in bad situations and, are not getting the nutrition they need, or the love they need, the nurturing that they need. And they just need someone to love them, or they just need somebody to talk to. For example, I had a child last week who I had to consult with my counselor, who was being bullied at school and who wanted to take his life. This child was only 14 years old. Oh, wow. And he wouldn't tell his mom what was going on. But I took the time to sit down and talk to this child and find out, why did you want to hurt yourself? What was your plan to hurt yourself? Mm-hmm. And then I in turn went and talked to our counselor, and then we in turn contacted the police and had this child taken to the hospital to get him the help that he needed. So all of our children that come here, they come from all walks of life, and you never know what they are going through or what they need. It could be that they need food, or they need clothing. And sometimes they're just too embarrassed to tell you, and it just takes maybe that extra 5 minutes or that 10 minutes just to sit down and talk to them, right. And it's just taking the time to do it. And I really, although I don't just see primarily kids, but I love my time that I get to spend with my children. Mm-hmm. They just really light up my day. Even though I love my adult patients, I just truly enjoy kids. I just do.
Right. I can see that, because from experience, I've seen you work, and I've seen how the kids respond to you. Mm-hmm. And that everybody don't have that relationship. Everybody can't do that. And it takes a special person with a special gift and an empathetic heart, and to connect with children that way. Mm-hmm. Because we always told that there's no good health without good mental health. And so knowing where they are mentally can also help you get, treat them physically and medically. So, I know for a fact that I appreciate you because you work so hard for the MAT program, but also, you work hard for my family, because my children, see you as for a physician. So, of course we got a trouble child that you have to deal with now, but we're talking about Junior, y'all. Junior. But he knows you, and he understands that when I go to this office, I'm going to see her. Mm-hmm. And a lot of times you don't be around for the bad stuff. Mm-hmm. So he's easy. It's easy for you to deal with him, and I really appreciate what you do in that aspect. Also, I appreciate the energy that you bring to the Dillon office, because we need that lively person, that person that can connect with everybody, that person that can connect with patients and even de-escalate situations. And I really appreciate that. That I think you've been a big asset to CareSouth and a big asset to Dillon County. And we're glad to have you.
Thank you.
So and let's shift gears for a minute and dealing with the MAT program. For somebody who don't know what MAT is, and just giving them an overview of what you do and what's required in MAT. Just give us a snippet version of what MAT looks like in Dillon with you.
I can honestly say, until I came to CareSouth and started doing MAT, I never really knew what it was. But it is a very rewarding part of my job. I can say that the patients that I see and who have been with me through me starting MAT in 2017, I still have some of those patients still with me today. I have seen total life changes in them. It is a very rewarding experience for me as their provider. I have seen them turn their lives around. I have seen them go from having nothing to having jobs, to having money, to getting married, to having a home, to going back to school, to getting their children back. It changes lives for those who want their lives to be changed.
Right.
It is such a game changer and such a positive experience for those who want it. But like I tell my patients, I'm here for you if you want me to be. I'm here to help you be successful and get over this hurdle if this is what you want. But you gotta want it. I can only do so much, but you got to do your part. Because if you're not ready, then it's not going to work for you. And I have had to discharge patients. It's not because I'm being mean but I'll tell them you're not ready. But when you get ready, come back and I'll be here to help you through this journey. But everybody's not ready for this journey.
Right.
You can't be ready because your mama tells you you're ready, or your husband tells you you're ready, or your wife tells you. You got to be ready when you're ready. That's right. And nobody can tell you you're ready until you know that you're ready. And some people tell you, oh, well, you're just switching one drug for another. But I can honestly tell you, Suboxone or Vivitrol, whichever one you do, it changes lives. I've seen it. It changes lives. These patients who get on this, you can't even tell that they're taking anything. They look like totally different people versus somebody who's taking something for pain, a Percocet or, something like that for their pain. They look like a totally different person. Mm-hmm. They can function in society and nobody even know that they're in the MAT program. And I tell them that nobody knows you're in the MAT program unless you tell them.
That's right.
Because they're so worried about, what is my supervisor going to know? What if they drug test me? Well, unless they're drug testing you for Suboxone, they're not going to know unless you tell them. That's right. Nobody knows that you're here for Suboxone unless you tell them. So, and another thing I tell them, because they're like, well, how long do I have to be on this program? Well, you're on this program as long as you need to be on this program. Mm-hmm. It's not my job to tell you, well, you got a year to be off. Right. You get off when you are ready to get off. When you feel that okay, I'm ready to come off. You know, you tell me when you're ready. I'm here to support you through this process. You know, we try to make, and that's another thing, we try to make our Suboxone patients here in Dillon, we make them feel just like they're a regular patient coming in here, whether they got hypertension or diabetes. We don't single you out. We don't make you feel any different than anybody else, because you're not any different. You're struggling with a disease process just like somebody who's struggling trying to get their A1C under control.
That's right.
And I don't know if that's why we have such a great relationship with our patients here. I don't know, but we do. Our patients tell us all the time that they appreciate us and they love us, and they're so thankful. And that, I mean, they even tell us that they're thankful for us because we saved their lives. And I'm like, no, we didn't save your life. They said, yes, you did, because you take the time, you talk to us, you listen to us. You know, they're like, we thank God for you. And I'm just like, well, you know, we appreciate that, but you know, we're just here trying to do a job. And they're, you know, they tell us all the time. They tell us, they tell our nurse, they tell our front desk staff, they're so thankful that we're just so nice, you know, and they're just so appreciative to us all the time. So we're just here trying to do good work.
And you're doing an amazing job. You're doing really, really well. And I know that's a difficult program. That's a difficult population of people to deal with sometimes, because they can be all over the place. But we have to understand that, like you said, it's a disease process, and nobody wakes up in the morning wants to be addicted to drugs. So in talking about the drug addiction issue and the epidemic that we're facing, what is some of the drugs that you were seeing is causing a problem in our society and in our communities? What's some of the drugs that's really causing the issue?
One thing that I have seen versus when I first started doing MAT to now is the increase in the fentanyl. I didn't see fentanyl when I first started doing MAT as compared to now. And that's really scary, because I'll have patients, and when my patients come in and I see things on their drug screens, I always discuss their drug screens with them. And I'll say, hey, your drug screen had, you had amphetamines and, methamphetamines, or you had fentanyl in, and they're like, what? I don't use that. And I'm like, well, this is what was in your drug screen. And, they get really scared. It was like, fentanyl kills people. And I'm like, yes. And it doesn't take a lot of it. It will kill you. And they're like, well, I took, an E-pill, or, and I'm like, and I tell them, I said, let me tell you something. I've never used drugs, and I don't, downgrade anybody that does, because I've never walked, I can't judge you because I don't know that walk. I said, but what I can tell you is the same guy that you're out here buying your marijuana from is the same guy that out here that's selling the cocaine and the fentanyl and the E-pills and everything else. And all he's trying to do is make a quick buck. So he doesn't care about, oh, well, let me make sure that I don't, mix this marijuana with this fentanyl or with this cocaine. All he's trying to do is make a quick buck. So he doesn't care that, oh, I might mix this up. All he's trying to do is make a quick dollar. I said, so he doesn't care if he kills somebody, because, all he's trying to do is make money. I said, so you have to be careful. You got to be careful. And if you really want to get better and kick this stuff, you got to leave all of it alone.
That's right.
You got to. I said, because you don't know if that one time that you tried this one E-pill, you don't know what it has in it. And I said, they're making stuff to try to cut it and make it last longer. And, I said, you just don't know. I said, I have discharged patients in the past because they couldn't leave the heroin and stuff alone. And I'm like, you're just not ready. I said, you're not ready. You're not ready to, because you can't leave it alone. And I've lost patients that have OD'd because they couldn't leave the heroin and stuff alone. And I'm talking about the youngest patient I've lost last year, as a matter of fact, was 21 years old.
Wow.
And she had two children. She died from an overdose of heroin. I mean, and I kept trying to talk to her. But she couldn't leave it alone. So I don't, only thing I can do, and I try to talk to my patients. I mean, and I try to talk to them about, inpatient facility. And I talk to them and I'm like, you got to leave these friends alone. And the only way, like I tell them, that you're going to truly be successful is you got to change your number, change your friends.
No.
Because you got to leave that whole circle. You got to leave them alone. Because when you're trying to do better, those people that don't want to do better, they're not going to want you to do better.
That's right.
So, I mean, and it's hard. I mean, you just got to, it's got to be a total life change. It's got to be a total life change. But the fentanyl, the heroin and all, I mean, that's the hardest thing I see for patients to kick. And even those patients that come to me, brand new patients, when I start them on Suboxone, 2 pills a day don't cut it. It does nothing. It does nothing for them trying to get them off of this, kicking the head. I mean, it's like it doesn't touch it.
Wow.
So I don't know. Even with cocaine, I mean, the Suboxone doesn't do anything, which I tell them it doesn't really help with it. It's hard, but the heroin and stuff has been, and I'm starting to see a lot more of that now.
Is there a decrease that you see, or is it remaining the same in people taking pills?
I would say, decrease in the pills. I don't see his pills as much as I used to. And one thing I've noticed too, with a lot of my Suboxone patients, that, because I have a lot of the ones that I've had for a while, it's like they trust me. So they tell me a lot of things. Like they're telling me now that, people are snorting the Seroquel, they're snorting the gabapentin, to get high and all this stuff now, that they have a hard time finding pills, on the street. So that's how a lot of them are deterring to the heroin, and then a lot of them are using like the e-pills. I have been seeing a lot more increase of the methamphetamine and the amphetamine. But like I said, I've been seeing a lot of the heroin. Yeah. I haven't seen as much pills.
I guess because of the mandates to the CDC and the World Health Organization and everybody else, is that the prescribing regulations have changed.
Yeah.
So you don't go and get a 30-day supply no more. You get 7. So there's not a lot on the street anymore.
Yep. Even the ER is not writing them. Like patients aren't getting them. And I have patients that have had surgery, like from orthopedics, and they're giving them like a little amount, and that's it. Like where they could go back, like they would give them a 30-day supply, and then they could go back because they're still having pain. They're not doing that anymore, because I've had patients come to me and it's like, they've had shoulder surgery, and they're like, I'm still having pain. And I'm like, well, you need to follow up with the orthopedic. Oh, they're not writing it because of the opioid crisis. And I'm like, well, I'm not writing it. They're like, well, I've been going to the ER. I was like, well, I'm not writing that. I'll give you some diclofenac or something, or some ibuprofen. That's it. I was like, I don't write that. Right. And they was like, well, yeah, I go to the ER and they give me like, 3 days, 5 days. I was like, yeah, nobody's writing that. They're not doing it. Right. So I'm like, you're going to have to find something else, So, yeah, I mean, even the surgeons aren't writing it like they used to.
Right.
So I mean, you're not finding, I'm not seeing the pills.
Kind of figured the pills was going down because of the heroin and everything else is going up. You made a statement earlier about if a person want to change, they have to change their phone number and change their friends. One of the statements I use a lot of times is that in order for a person to be a different person, and change your normal routine. That you have to change your playmates and change your playground. Because if you change one without the other, the same games are going to take place. So you have to change the whole environment. And so if you can't do that with some I guess what they call behavioral health modification and everything, changing your mindset as well, then you're gonna struggle with this program. And so that's why behavioral health is such a big part of what we do with MAT, to help a person change mentally as well as changing their the cycle of doing things. So we really have to stay vigilant, especially now with the summer months coming along. A lot of people are going to be out of work. Children are going to be out. Stress levels are going to be higher. We're still dealing with a pandemic, so we're still going to see an increase in this in the use the need for MAT services. So we really appreciate you being available and having the availability and the access to get patients in to see you. We really, really appreciate that.
Yeah, and I tell them, a lot of them think, well, why do I have to do counseling? I'm like, that's a huge part of your recovery, because it's like you get depressed, because it's like, okay, your friends that you had, these were the people you were hanging out when you were doing, you were getting high. These are, they understood, what you were going through when you felt down, and, so you need somebody to help you through this process. And, and then I hear a lot of my patients tell me, well, my family just says, why can't you just stop? And I said, well, this is why it's so important for your support system to be a part of your counseling as well. I said, because most people don't understand. They don't understand addiction. They don't understand, well, why can't you just stop? Because they don't understand how it's a chemical imbalance in your brain. Just like people who smoke cigarettes. That's, I've never smoked, but people say that's like one of the hardest things to do. It's it takes, just like they say, it takes a village to raise a child. It takes a village to, to get through this recovery. You need to have a strong support system. And I said, I've had plenty of my patients who I tell, I had a husband one time. His wife didn't understand. She didn't understand. I said, tell your wife to come with you to your next appointment. And I'll sit down and I'll explain it to her, and I'll give her some, some information. And I did. And I said, and I'll give her opportunity to ask me some questions. And I did. And it really opened up her eyes, for her to ask questions and for me to be able to explain to her, because she couldn't understand why he couldn't stop the pills, and for her and him to go to Tara and actually have her to do counseling with him, with our counselor, because a lot of times they just don't understand. They don't understand. Why can't you just stop the pills? Why can't you just do, if you love me, you would stop. But you have to understand, it's not him. It's the addiction. It's the chemical imbalance of the brain that's causing him to do this, that's causing the need. So, I think, so I tell my patients, I said, tell your spouse to come, or tell your mother to come, so they'll understand. Because a lot of times when you're getting that beat down on you all the time, that can be depressing too. It's like, well, you don't understand. I'm trying to do the best I can, but yet I'm getting beat down all the time for trying to do the right thing. I only used one pill, where before I was taking 10 a day. Shouldn't I get some credit for that? But it's a constant struggle. It's a constant struggle. And and I would tell patients, they'll be like, well, I only use one time, where I usually use, 5 days out of the week. And I'd be like, well, that's great. That's good. That's good. That's a great step forward. So next week, let's try to use none, And I'm like, you got to look at it like that. Okay, you messed up. That's fine. Let's try not to mess up. Tomorrow's a new day. You have to look at it like that, I don't know. I just feel like they have to feel like they got somebody in their corner.
They do. I think what a lot of people miss too, Samantha, is that after 120 days of using an opiate, right? For pain, just say if I'm using it for pain, for legitimate pain. After 120 days of that usage, my pain tolerance decrease, and my need for that medication increases. And so over time, my brain begins to develop receptors that crave that because it needs that now, becomes dependent. And so now it's a normal process of your brain to have this craving every single day. Just like it's the same reflex that you have to breathe. And so that's why it's so hard to go. That's why withdrawals are so hard, because now you're stopping the body from doing a normal function. You know, that has become normalized in your physiology. And whenever you break that, whenever you try to break that cycle, it's a bad thing.
Yeah.
But going through that period of withdrawal can be the point that can be that those inches that save your life.
Yeah.
Because if I can make it through this week or these couple of days of withdrawals and get into treatment, then I can start. I would never lose those receptors. Depends on how long I've been on drugs, but I can manage my addiction and manage my craving, which is very, very important in this process. I think whenever Marette comes on, he's going to ask you another question. But so I know you're looking forward to the new building that's being built over in Dillon.
Oh yes, can't wait. We've been waiting for years.
Yeah,
Can't wait.
Yeah, and you know, I think you've probably gone by and seen the process, you know, the progress of it. And we got a foundation, we got the big beams and everything going.
We got stuff coming out the ground. Hallelujah.
We got walls going up. We got walls.
Right.
I looked at
I
walls.
hadn't been by there to see. Hadn't seen the walls.
They got walls. The tower up.
Oh,
yes. So it just be a matter of time. Just a matter of time.
So we might get in there before the end of 2021.
We might. That's very possible. We're praying. We got our fingers crossed, right?
I know that's right. I'm across all of them.
And my toes and my eyes, right?
I know, right?
That's right.
So, Marek, I think it's an important question that you ask our guests whenever they on. You always ask them this important question. I think she's probably about ready for that.
Yeah. So I'm gonna add to that question as well. So that question is usually when Samantha's not doing CareSouth Carolina and Samantha's not working to be Dr. Samantha, what does Samantha do for fun?
Shopping online. Uh-oh.
Okay. Shopping online.
I think she froze a little bit.
I would have froze on that too.
Yeah. Yeah, probably freeze her accounts on that too. So Samantha be shopping all the time.
Yeah.
But I like to go in her office, Marek, because you know Samantha always keep goodies in her office, and she always have things available for us in there whenever we go. I guess just to make us feel at home. You back, Samantha?
I'm back. I don't know what had happened.
When you froze, your twin froze in the corner, but it's okay.
Yeah.
I don't know what had happened. But yes, I love shopping online. Can you hear me?
Yeah,
Yep.
we had you.
Oh, okay. Yeah. I love shopping online. It's not good though.
She did that 5 times. She said that 5 times, Marek. So she really loves shopping online.
Yeah, my husband said he's tired of seeing the boxes come to the front porch.
Are you an Amazon shopper?
I'm an Amazon. I'm an everybody shopper.
Have you ever opened up your Amazon account? You had to do it from desktop, and you could pull your order history, and it'll tell you how much you just spent. That was eye-opening for me.
Yeah.
And it's bad because my youngest daughter, she be shopping too. My husband told me he said I created a monster. So she be shopping too.
Yeah, that's a learned behavior. That's a learned behavior.
And
that's how I deal like my stress. Now I'm not one. I don't buy big purchases like I don't go buy cars or houses or nothing like that. it just be pocketbook, shoes.
Yeah. Little top here and there, right?
Yeah, that kind of stuff.
Well, we were talking about how you keep your office stocked with goodies for everybody, and that we love to go and visit.
Yeah, the front desk people be like, Samantha, can I get? I'll be like, and I tell them, you don't have to ask. Even my patients, the kids, they know that I got candy. The patients know I have stuff in here. I share with everybody.
That's right.
So
I just tip in and tip out.
Yeah. I don't mind. I don't mind.
I just like to go look, Marek. I just like to go in there and look and see what she got.
Yeah.
Every now and then I take something, but not often.
Yeah, everybody does. Even when Dr. Smith comes in here, he just kind of looks and peeps. Everybody just kind of looks. I always keep it out, It just kind of hangs out. I don't mind.
I was wondering what the grocery bag was Daniel walked out with the other day.
Oh yeah.
Well, sometimes you just run a little short. You have to go and restock. So thank you. But just in that in itself, the way that you have everything open for everybody, it shows your heart and your willingness to give to people. And that's what makes you special. And that's what makes you such a great provider, your heart and your willingness to give.
Well, thank you. I always try to treat people the way I would want to be treated, or the way I would want my family to be treated.
One more thing before we close out, and just in celebration of Nurses Week as it comes to a close, could you share with us real briefly what made you choose this profession? Why a nurse? Why a nurse practitioner?
Well, I always knew, ever since I was like 4 years old, I told my mom that I was either going to be a nurse or a pediatrician. I had a great aunt that was a nurse, but what really pushed me to be a nurse was I had a cousin who took an overdose of Tylenol when she was pregnant with a child, and her baby ended up in the NICU. And I went to see her baby, and from the time I saw her baby, I was like, this is where I'm going to work. This is what I'm going to do. And when I became a nurse, that's where I worked. And I worked in there. Now, in between working in there, I worked in IT some, and then I taught some, but I did PRN in there while I finished up Nurse Practioner school. And I enjoyed working in it. That was a very rewarding job. But I just always knew I wanted to work in healthcare. I wanted to be a nurse. Being a nurse is a very rewarding profession. Right. I don't know. I always felt like I always wanted to help people. And you can always see what you do for people. And it's just like, it's my way of giving back. I mean, just like with me precepting students now, it's like, it's how I can give back. Somebody took the time to help teach me, so I can help teach them what somebody taught me. Right. And I just enjoy it. It's just my way of giving back. And I just enjoy helping take care of people. I enjoy meeting new people. And I don't know, I just enjoy it. I love what I do. Now, granted, some days are off the chain and you just want to go home and just, but for the most part, I love what I do. I love my people I work with, and I love my patients. I can't think of anything else I would rather do.
Thank you.
Well, one more question, Marek. What about, have you taken the vaccine?
Yes, I did. I got my first dose in January and my second dose in February. Didn't have any problems, and I was very worried because I have bad allergies. I take allergy shots every week. So I was really worried about the Pfizer. Did not really want to take that one. So I was kind of waiting until we got the Moderna here. And I took the Moderna, had my EpiPen just in case. But did great. My arm was just a little sore. Took Tylenol, didn't have any reactions. So I encourage any and everyone to get vaccinated who hasn't got vaccinated. And the crazy thing is, like when they were first talking about the vaccine, my dad, who will be 78 next month, he was like, I mean, this was like last year. He was like, I can't wait till they get the vaccine because I'm going to get mine. I was like, you need to wait and find out what the data is before this vaccine, because, you know, it usually takes some years before, you know, we know what vaccines. I said, you need to see the numbers. He talking about, I don't care. I'm going to get the vaccine. I was like, I don't know about this. I just don't know. I was like, I don't want COVID, but I don't know about the vaccine. He's like, well, I'm getting mine as soon as they tell me I can. So I was like, I don't know. But the thing that really made me feel comfortable about getting the vaccine was when I saw you guys' podcast that you guys did with the state epidemiologists. And I shared your podcast with my family members and some of my friends who also had, you know, just kind of on the edge about the vaccine.
Mm-hmm.
And my husband too, because my husband has hypertension, diabetes, but you know, he actually got the Pfizer because he works at McLeod. But that was really all of our turning point to be like, okay, we're gonna get this vaccine.
Good.
And I'm glad that I did, you know, and I didn't have any reaction. And I encourage people to do it because, you know, I feel like, granted, I mean, yes, we can still get COVID, but if we practice our social distancing, we wash our hands, we wear our masks, you know, it still protects us. But if we get COVID, at least, thank God, we won't die, you know?
Yeah.
So, and just like now, I still, you know, my patients ask me, what do I think? And I tell them, I think that it is, you know, definitely, you know, get the vaccine, you know, but ultimately it's, you know, it's your choice. But I think that, okay, it's definitely going to prevent you, you know, save your life. And, you know, I tell people I got it to protect my health, my family's health, my patient's health, and everybody that I come in contact with. At least I know that I'm vaccinated, and hopefully and prayerfully I won't give it to anybody, because I'm going to continue to wear my mask, wash my hands, and social distance. But I do encourage, you know, people to get it. And I meant to tell you guys that I was very, you know, grateful for your podcast you did, because I shared it with my family, my friends, and it was very informative. And that really, you know, helped us make our decision to get it. Yeah.
Well, thank you very much.
It was very good. I mean, it was very good. It was very good, because I was really on the fence, because I'm like all about data, and I'm like, vaccines need to be out for some years before we be sticking people. But when I saw that, I was like, okay, yeah, I feel a lot better.
Yeah,
you know,
science
and
made
I mean,
sense,
that's the
right?
thing. People need to have the information, and y'all did such a great job with that. You know, like I said, I shared it, you know, with a lot of people, and they was like, oh, well, you know, we didn't know that. You don't see that on TV. You know, you don't have all that information. So, yeah, that was really good.
Wonderful.
Yeah,
Thank you.
Well, thank y'all.
No problem.
Yeah.
Well, we thank you for coming on with us today, and you know, hopefully we can get you back at a later date as we progress and get into the new building. We have your office mate next week. We're gonna introduce her to everyone, Dr.
Okay.
Cabrera. Yeah.
Okay.
So thank you again for coming on. We hope you have a wonderful weekend.
All right. Thank y'all too.
And happy Mother's Day.
Have a good week. Thank y'all.
Yes. And if you want to hear more about CareSouth Carolina and to schedule an appointment with Miss Samantha here, you can reach us at www.caresouth-carolina.com or 1-866-498-0399. And she's in the Dillon office.
Bye, y'all.
All right. See you later.